As we age, our bones can become more fragile, making us vulnerable to fractures. Fractures are breaks or cracks in bones. These injuries can significantly impact an elderly individual's mobility and independence. It's crucial to understand the causes, symptoms, and management of fractures in the elderly to ensure timely intervention and optimal recovery. This essay will guide you through these aspects, empowering you with knowledge about prevention and rehabilitation. Early detection and proactive management are vital for a smoother recovery journey. Understanding the risk factors, recognizing the signs, and seeking prompt medical attention are the first steps towards regaining strength and mobility. Throughout this guide, we'll delve into the intricacies of fracture management, emphasizing the importance of a comprehensive approach that encompasses medical care, physiotherapy, and lifestyle modifications. This essay will equip you with the information you need to navigate the challenges of fractures and post-operative conditions in the elderly. We'll explore the common causes, symptoms, and risk factors associated with these injuries. We'll also discuss various diagnostic procedures and outline the crucial role of physiotherapy in the recovery process. Fractures in the elderly often occur due to a combination of factors. These factors can be broadly categorized into intrinsic and extrinsic causes. Intrinsic factors are those related to the body's internal conditions, such as bone density and muscle strength, while extrinsic factors are related to the environment and external influences. Understanding these factors can help us take preventive measures and minimize risks. By addressing both intrinsic and extrinsic factors, we can create a comprehensive approach to reducing the incidence of fractures in the elderly population. Age-related changes in bone density and strength play a significant role. As people age, their bones naturally become less dense and more fragile. This process, known as osteoporosis, is particularly common in postmenopausal women, but can affect men as well. As we age, our bones naturally lose calcium and other minerals, making them weaker and more susceptible to fractures. This loss of bone mass can be exacerbated by a lack of dietary calcium and vitamin D, which are essential for maintaining bone health. This natural process, coupled with decreased muscle mass and balance, increases the likelihood of falls, a leading cause of fractures in older adults. Muscle weakness and poor balance can make it difficult for elderly individuals to navigate their environment safely. Besides age-related factors, accidents and falls are common culprits behind fractures. Falls can occur for a variety of reasons, including tripping over objects, slipping on wet surfaces, or losing balance due to uneven ground. Tripping over rugs, slipping in the bathroom, or losing balance on uneven surfaces can lead to these injuries. It's important to be aware of these hazards and take steps to mitigate them. It's essential to create a safe living environment for elderly individuals to minimize fall risks. This can include making home modifications to reduce hazards and improve safety. This includes removing tripping hazards, installing grab bars in bathrooms, and ensuring adequate lighting throughout the house. Additionally, using non-slip mats in the bathroom and securing loose rugs can further reduce the risk of falls. Certain medical conditions can also increase the risk of fractures. Conditions such as osteoporosis, arthritis, and diabetes can weaken bones and make them more prone to breaking. Osteoporosis, a condition characterized by weak and brittle bones, is a major risk factor. This condition can be managed with medications and lifestyle changes, but it requires ongoing attention and care. Other conditions, such as arthritis, diabetes, and hormonal imbalances, can also weaken bones, making them more prone to fractures. Managing these conditions effectively can help reduce the risk of fractures. Medications like corticosteroids, often prescribed for inflammatory conditions, can also have a detrimental effect on bone density over time. It's important for healthcare providers to monitor bone health in patients taking these medications and consider alternative treatments when possible. Preventive measures such as engaging in regular weight-bearing exercises, maintaining a healthy diet rich in calcium and vitamin D, and participating in balance training can help strengthen bones and improve overall stability. Regular medical checkups and bone density scans can help detect early signs of bone loss and allow for timely intervention. By staying proactive about bone health, elderly individuals can reduce their risk of fractures and maintain a higher quality of life. Ultimately, understanding the causes of fractures in the elderly and taking appropriate preventive measures can help them lead active, fulfilling lives. By addressing both intrinsic and extrinsic factors, we can create a safer and healthier environment for our aging population. Recognizing the signs and symptoms of a fracture is crucial for prompt medical attention and effective management. Fractures can occur in any bone in the body and can result from various causes, such as falls, direct blows, or even medical conditions that weaken the bones like osteoporosis. Understanding the common indicators can help in seeking timely treatment and preventing further complications. Pain is usually the most immediate and noticeable symptom. It often starts suddenly at the time of injury and can be quite severe. The pain may worsen with movement or pressure on the affected area, making it difficult for the individual to perform daily activities. The intensity of pain can vary depending on the severity and location of the fracture. For instance, a minor hairline fracture might cause mild discomfort, while a complete break can result in excruciating pain. It's important to note that pain tolerance varies from person to person, so any persistent or severe pain should be evaluated by a healthcare professional. Swelling around the injured area is another common sign, often accompanied by bruising and tenderness to the touch. Swelling occurs as the body's natural response to injury, where fluids accumulate around the damaged tissues. This can lead to a noticeable increase in the size of the affected area, making it appear puffy or enlarged. Individuals with fractures may experience limited mobility or inability to move the affected limb or joint. This restriction in movement is often due to pain, swelling, or the mechanical disruption caused by the broken bone. In some cases, the individual might hear or feel a grinding sensation, known as crepitus, when attempting to move the fractured area. For instance, a fractured wrist might make it difficult to grip objects or make a fist, significantly impacting the person's ability to perform tasks like writing, eating, or dressing. The loss of function can be frustrating and may require assistance from others or the use of adaptive devices. While a fractured ankle can make walking or putting weight on the foot unbearable, this can severely limit mobility, making it challenging to move around the house or go outside. In such cases, mobility aids like crutches, walkers, or wheelchairs might be necessary to help the individual maintain some level of independence. In some cases, there might be visible deformity, especially with severe fractures, where the bone is displaced. This can result in an abnormal shape or alignment of the limb, which is often a clear indication that immediate medical attention is needed. X-rays or other imaging techniques are typically used to confirm the diagnosis and plan the appropriate treatment. Post-surgery, it's essential to be vigilant about potential complications. Surgery is often required to realign and stabilize the fractured bones, and while it can be highly effective, it also carries risks. Monitoring the healing process closely can help in identifying any issues early on. Redness, warmth, or swelling around the surgical site could indicate an infection. Infections can delay healing and lead to more serious health problems if not treated promptly. It's important to keep the surgical area clean and follow all post-operative care instructions provided by the healthcare team. Any discharge from the incision site, especially if it's foul-smelling or pus-like, should be reported to a healthcare professional immediately. This could be a sign of a serious infection that requires medical intervention, such as antibiotics or additional surgical procedures. Persistent pain that doesn't subside with medication or worsens over time could also signal a complication and requires further evaluation. Chronic pain can be debilitating and may indicate issues such as improper healing, nerve damage, or other underlying conditions. Regular follow-ups with healthcare providers are crucial to ensure proper recovery and address any concerns that arise during the healing process. Fractures in the elderly present unique challenges due to age-related physiological changes and pre-existing medical conditions. These fractures are not just simple breaks. They often come with a host of complications that can significantly impact the patient's quality of life. The bones of elderly individuals are more brittle and less dense, making them more susceptible to fractures even from minor falls or accidents. Additionally, the presence of chronic conditions such as osteoporosis and diabetes can further complicate the healing process. One significant clinical feature is the potential for delayed wound healing. This delay is often due to a combination of factors, including reduced skin elasticity, slower cell regeneration, and compromised blood flow. In elderly patients, wounds that would typically heal within a few weeks can take months to fully recover, increasing the risk of complications. As we age, our skin becomes thinner and less elastic, and blood circulation slows down, all contributing to a slower healing process. The reduced blood flow means fewer nutrients and oxygen reach the wound site, which are essential for tissue repair. This can lead to chronic wounds that are difficult to treat and can become a source of ongoing pain and discomfort. This delay increases the risk of infections, especially in open fractures where the bone breaks through the skin. Open fractures are particularly dangerous because they expose the bone and surrounding tissue to bacteria and other pathogens. Infections in these cases can lead to severe complications, including osteomyelitis, a serious bone infection that can be challenging to treat and may require long-term antibiotic therapy or even surgery. Another concern is the loss of joint function and muscle weakness. When a fracture occurs, the affected limb is often immobilized to allow the bone to heal properly. However, this immobilization can lead to joint stiffness and a decreased range of motion. Over time, the muscles surrounding the fracture site can atrophy due to lack of use, making it even more difficult for the patient to regain full function. Immobilization, often necessary to allow the fracture to heal, can lead to stiffness and decreased range of motion in the affected joint. This stiffness can be particularly problematic in elderly patients, who may already have pre-existing conditions such as arthritis that further limit their mobility. Physical therapy is crucial in these cases to help restore joint function and prevent long-term disability. Muscles surrounding the fracture site can also weaken due to lack of use. Muscle atrophy can set in quickly, especially in older adults who may already have reduced muscle mass. This weakening of the muscles not only affects the injured limb, but can also impact the patient's overall strength and balance, making them more susceptible to further injuries. Physiotherapy plays a vital role in addressing these issues, restoring joint mobility and strengthening weakened muscles. Through a combination of exercises, manual therapy, and other interventions, physical therapists can help elderly patients regain their strength and improve their functional abilities. This not only aids in the recovery process, but also enhances the patient's overall quality of life. Impaired balance is another significant concern after a fracture, increasing the risk of falls and subsequent injuries. Balance issues can stem from a variety of factors, including muscle weakness, joint stiffness, and changes in proprioception. For elderly patients, a fall can be particularly dangerous, often leading to additional fractures or other serious injuries. Elderly individuals may develop a fear of falling, leading to decreased activity levels and further functional decline. This fear can create a vicious cycle where the lack of activity leads to further muscle weakness and joint stiffness, increasing the risk of falls even more. Addressing this fear through education and supportive interventions is crucial for helping elderly patients maintain their independence. Physiotherapy interventions focus on balance training, gait retraining, and exercises to improve coordination and proprioception, the body's ability to sense its position in space. These interventions are designed to help elderly patients regain their confidence and reduce the risk of future falls. By improving balance and coordination, physical therapists can help patients achieve a more stable and secure gait, enhancing their overall mobility and quality of life.